So there's just one topic that's been on my mind since my circle the other day, where we were discussing teeth and the connections between certain chronic illnesses and teeth problems, and so on and so forth. And I remember going to the dentist recently and feeling very ignored, very like he wasn't fucking listening, because he wasn't. And he was bringing things up that I had brought up to my doctor years ago after chemotherapy and after a lot of treatments that I received. And it's frustrating because if he really wanted to know my connection with those, he could have asked directly and I would have answered the question. But I don't answer cryptic questions, even if I know why they're asking them, because it's not my business to do your job. But, anyways, so I've had dental issues since I was 8 years old, where I crack my molars from TMJ and teeth grinding. Okay. That's when I've got my first root canal to prevent any infections, because I had already broken the tooth so much that there was barely any tooth left. So one of the teeth had to be removed and the other one had to be capped, right? And then my teeth didn't fit in my mouth. So they removed some teeth and then they had to like open the top of my mouth right here so that these two teeth would come down. Okay. They cut the flap open, they sewed it to the top of my mouth, and a few days later, they took the stitches out and just let it go back down once the teeth had passed a certain thing, because since they didn't fit, they got stuck. And to prevent further damage, that's how Mexican dentists repair that, right? I don't know if that's still what they do here in America, because I've gotten very minimal dental care here in America. And once I did start getting it, the problems had already increased. And this is what I tried to explain to my doctors here in the US, that all of the medications and treatments that they had me on caused problems, but not those particular problems. I will always crack my teeth because of the grinding, but essentially, and because they don't fit, because they're moving forward, like it's getting tighter. The top part of my mouth is getting tighter, and so is the bottom, to the point where my tongue doesn't feel like it fits. It feels like it's suffocating me at night. Okay. And that's been slowly progressing as I get older. Like, as I even got a bone graft over here because I'm losing bone, density, I think it's called, but I don't know what it's called in English. But, anyways, basically, that's a problem I've had since childhood. What the medications did to my teeth was start to disintegrate my teeth, okay? Make them more fragile, but also what they started to do was create abscesses. I have a problem with frequent abscesses now, something I didn't have before. So I feel, I can't prove it, but I did to several of my doctors here in the United States. And this is why I emphasized wanting to get off of the bunch of pharmaceuticals that they had me on. I emphasized and emphasized and emphasized that these abscesses were a problem, because I feel like it was making my bone like have more holes, not necessarily like huge giant holes that are visible, but enough for abscesses to form. So any tooth crack or anything like that is almost guaranteed now to cause an abscess. Not necessarily in the tooth that I cracked, because in this particular case, the abscess was actually in the tooth next to it because of the crack that I did, but I could feel it forming. Very small, very tiny as it was forming. This time it only took one course of antibiotic. I still have to go back to the dentist to make sure that everything has cleared up to prevent further problems. However, in Mexico, the abscesses would go so far down that they would have to inject antibiotic directly into the gums, into those abscesses, when they couldn't reach it through the teeth, because before I had all my molars. And so it's incredibly frustrating when doctors try to say, oh no, it has to be definitive one thing, because you don't understand the complexity of the human body. So you want to diagnose one thing, and it has to be that one thing, and it has to fit perfectly. But this is why comorbidities get what is the word? They get overlooked because of their complexity. Because here in the United States, you want to treat every body part like it's separate, not realizing that the human body is one. It's one freaking human body. And the more that you guys try to ignore that fact, the more you're going to continue to make mistakes when it comes to the human body, not just in dental care, but the entire human body and the organ function and everything. Because instead of working together within all of these different specialties, because you want to feel special within your specialty and you want to feel like you're the authority within that specialty, you're not talking to other specialties about how the disease that you are specializing in affects other organs or other body parts. But a lot of hypermobile or HSD problems also include the mouth. And I've tried to fucking explain this to doctors for over 15 years. The emails in Kaiser Permanente prove this, because I even sent them records of my dental and everything from the time that I started chemotherapy up until I stopped fighting them on it and just started taking care of myself because they weren't fucking listening. But I showed them all the interconnections between the mouth, the eyes, the body parts, and everything. They just were not fucking listening, because this aura in this eye, or it's like looking through a raindrop, and it causes a lot of color. It has been there for so long, and it's very, very frustrating when you're not being heard, when these motherfucking assholes want to feel special. And that's the thing. And that's recently I was talking to somebody, and they're like, well, you have to find the one thing that you're good at, and that's what you got to capitalize on. That is why you're not special. None of your specialties are special. That's why you don't do your job well, and you ignore and gaslight so many. Oh, look, it's not off yet. Okay. And you ignore and gaslight so many patients because you're not willing to try to understand the human or the female body and how our bodies respond so drastically to hormones. So drastically. Because you don't want to understand the complexity. You just want to feel special within the one thing that you know. And you don't want to expand on that. And it's really sad to me, because a lot of you have potential. You're just not willing to fulfill that potential. And yes, TMJ causes a lot of problems. But TMJ on its own is not essentially a problem, because I've almost bitten my tongue off in my sleep several times, where I've bitten the tip of my tongue and I wake up because there's too much blood in my mouth and stuff like that. So my jaw does lock from time to time in my sleep. Do I know what's causing that? No, I fucking don't. But essentially, can it be dangerous? Absolutely. If I get a big enough piece of my tongue, I'm assuming, it is an assumption, and I could be making an ass out of myself and out of you guys. But the assumption in my heart and soul is that if I was to have my tongue a little further out, I could seriously injure myself in my sleep. And I used to wear guards or whatever. I just keep forgetting to buy one when I'm at the store. And I don't have the specialized ones that don't break as easily, because the gummy ones, I chew through them within less than a week sometimes. So it is essential that you get proper dental care no matter what, because dental hygiene is directly, and people will talk shit about me when they see the whiteness on my teeth, but they don't understand that I form thrush on a daily basis. So even if I'm doing all of my dental care, when I'm having flare-ups, I have really bad thrush, because during flare-ups, a lot of times I have issues with abdominal bacteria as well. So people form ideas and opinions about how dirty and blah, blah, blah I am about my teeth. However, I'm the one person in the house that has always had great dental hygiene. And it really frustrates me that people form opinions without understanding that one day you can form all of these issues too. Okay, this is not excluded just to me, but living in a house with mold in it caused a lot of issues with me forming mold in my sinuses, my ears, my brain, and my mouth. So just keep that in mind, because a lot of that is signs that you're living in a moldy house. Just FYI, that's one of the things. And trying to convince a doctor to do a mold toxicity test is very frustrating, because a lot of times they don't want to do it. And so, anyways, mouth directly affects your sinuses, your ears, your eyes, your heart. If you get a serious infection, it can affect your heart. That's why I'm so freaking anal about abscesses. As soon as I feel it coming on, I get frustrated when people do not hear me. And that's why my mom would take me to TJ, because they would get it done same day. They'd get it done same day, and they didn't bullshit around like they do here in the United States. They directly fix the problem before it becomes worse. They don't make you wait weeks or months before you get proper dental care. And essentially, it's because we've put dental care as something like away from actual health. But if your dental care is not good, then essentially neither is your health. Because our dental health, even our breath, can tell us a lot about how our gut is doing. And the way we form infections can also tell us a lot about how our food, our environment, and so on is affecting our health. So a lot of times when I'm struggling with certain things, I understand, hey, you know what? You're going through a flare up of something else. And it's very frustrating when it takes someone who gets certificates and all that stuff to say it before doctors actually fucking listen, because I've been saying this for a very, very long time, and I've been ignored for a very long time, despite my experience expertise, like from experience. And I don't want to be an expert in anything. I don't like knowing as much as I do, because I get made fun of a lot. Oh, la doctora, like they make fun of me about how I know a lot about different topics, but it's the only way I've been able to survive the American healthcare system, the American dental system. Okay, just FYI. So many of us who are low income individuals and who have had to rely on family members and got tired of needing to ask for money to get these things done because of how we were treated, many of us have become experts in our own health. And it really sucks, but it also helps you advocate better. That's why it frustrates me when doctors put nonsense labels, because they don't want to admit, hey, you know what? I might be wrong. I might be a little off, because I said it right earlier, comorbidities oftentimes will mask some of the symptoms of one thing while flaring up the symptoms of others, or vice versa. And a lot of times that will make it very difficult to diagnose different things. However, understanding this can help you expand and open your brain when you do have a person who is verified that they aren't regular individuals. You know, people always say when you hear hoofs, they're horses, not zebras. However, when you do have somebody who has been through the medical healthcare system multiple times and proven to be a zebra, you want to stop thinking about horses. And oftentimes, when they get older and things start to flare up more, because age makes things flare up more in a lot of cases, hormonal changes and things like getting hysterectomies or pregnancy or even premenopause and menopause can oftentimes flare up diseases. Even your menstrual cycle, if your menstrual cycle isn't regular or it's having a lot of issues, oftentimes it can cause flare-ups in certain things. And doctors not understanding or not wanting to understand that really puts women at risk for everything, including dental care, because a lot of women lose their teeth because of childbearing. Just FYI, it's a real thing. So keep that in mind, especially if you take steroids, if you take long-term painkillers, if you take long-term antidepressants or anxiety medication. Make sure that you're also keeping up with your dental care, because essentially if your dental health isn't well, a lot of those things that you're taking that medication for, your chronic illnesses, your mental illnesses, your anxiety, I guess that falls under your neurodivergence. Sorry, that's what I was looking for. Your neurodivergence and all of that can be drastically affected by our dental care, our gut health, and our nervous system. It can all be flared up by just having a little of a bacterial infection in your mouth that is making things flare up. So keep that in mind and stop being idiots. If you have a patient that is constantly getting dental infections and abscesses, when you have them on long-term chemotherapies or steroid treatments or anything like that, your healthcare insurance should fucking cover it. That's something I should have insisted Kaiser do, because essentially they never warned me how much all of those medications were going to affect my teeth. So they accelerated a problem that I already had by creating an abscess problem and a teeth fragility problem, because I always had to take extra calcium. But then they make it hard, like, oh, you're taking too much calcium and that's why your kidneys are this or that. That's why when I had my gallbladder stone, they would say that it was because I took too much calcium. No, honey, I take too much calcium because a lot of the medications you give me leach off of that calcium. And I'm not absorbing it properly anyways. So taking a little more is beneficial, since you guys don't want to prescribe powdered form or liquid form of many of the medications. So go suck it. And I mean, for real, go fucking love yourself, because essentially a lot of the things that y'all do are harmful because of your biases. I love you and have a beautiful night. I know. Teeth rant. My beautiful smile has to remain beautiful as long as possible. But yeah, I do have a lot of issues with infections. I've even had a type of yeast infection that grows on the skin just because of sun contact, like having too much sun and things like that. It actually flares up a certain type of yeast that I've grown on my skin since I was a child. And I haven't had that in a very long time because I have learned how to prevent it. But essentially, it took learning how to prevent it for me to be able to not do it over and over again. And it really frustrated me when my sister's kids were teenagers and her youngest daughter started to develop that, because it's not every single member of our family, but my older brother had it, I myself had it, and my youngest niece had it. That if you're taking consistent bubble baths and not washing and scrubbing your skin afterward, and you already are prone to respiratory infections and sinuses infections and things like that, you may also be more prone to getting those skin yeast infections, especially if you're constantly getting antibiotics for those other things. Unfortunately, antibiotics fuck with our gut bacteria so badly, and doctors are so quick to prescribe antibiotics, but not quick to prescribe probiotics and prebiotics other than just yogurt to prevent yeast infections in, down there and stuff like that. But they don't realize that for a lot of us, we don't get the yeast infections down there that often, unless when I was on chemotherapy, that I was for about 2 or 3 years on a consistent antibiotic every day for those 2 or 3 years. And then I started to develop problems down there. But other than that, it was constantly in my skin as a teenager and things like that. And I noticed growing up that it had a lot to do with my hormones as well, with my allergies and my hormones, and it would cause a huge flare-up. And it's very frustrating, because this means that things like MCAS have existed for a long time, and you guys have not been diagnosing properly because your diagnostic criteria is limited to certain types and forms of testing for those things, and not actually listening to what the patient is going through. So you end up not putting in their chart, don't be quick to give them antibiotics. Try to solve the problem if it's not an extreme problem, because back in the day, they would easily prescribe antibiotics for everything. Keep that in mind and learn your body. You are your best advocate, always. This is not medical advice. This is not professional advice. This is not legal advice. However, I am telling you, learn your body well enough so that when a doctor is off their fucking rocker, you can still advocate for the right testing. Because even if you're wrong, the testing will take you out of doubt so that you can find the right thing. If they're not willing to even do the testing, they put themselves, it should be a liability, but they put you at risk by not wanting to do the testing. Okay. I love you and have a beautiful night. Take care of your teethies.